Good afternoon, everybody. The Secretary to the Government of the Federation, all ministers, directors here present, ladies and gentlemen. The global number of COVID-19 cases has crossed the 1 million mark, barely 3 months after the outbreak was first reported in Wuhan, China. It is an indication that it is a public health challenge that we must not take lightly. Here in Nigeria, we recorded 10 new COVID-19 cases over the past 24 hours, so that cumulatively we have 6 new cases, and 20 cases have been discharged from hospital after successful treatment. There are 98 in Lagos State, 48 in the Federal Capital Territory, 20 in Osun, 8 in Oyo, 5 in Akwa Ibom, 4 in Edo, Kaduna, and Ogun, 3 in Bauchi, 2 each in Enugu and Ekiti, and 1 each in Rivers and Benue State. We are already seeing what may be indications of sustained community transmission, in the sense that 30% of the cases have incomplete epidemiological information, while 51 are imported cases and 19% are contacts of known cases. We are using the small window of opportunity remaining to intensify investigations to identify cases and their sources. This is one of the purposes for which the lockdown of 2 states and the Federal Capital Territory was proclaimed by the President. These areas, especially Lagos as primary epicenter, but also other parts of the Federation, will need to speed up their activities to detect and isolate COVID-19 patients. During and following the lockdown, we expect to see an increase in cases as a measure of improvement in case finding. If all the social distancing and other measures are adhered to, the incidence of positive cases can be controlled. We have tested nearly 3,000 samples so far, and we are working hard to scale up our capacity in a targeted approach. Coronavirus Treatment Center Accreditation Committee was inaugurated yesterday by the Honorable Minister of State for Health and has begun developing an accreditation checklist as well as a protocol for management of isolation centers. We are compiling a list of trained workers in the health sector to man the centers as they become operational. Directors of the Federal Ministry of Health had discussions with the Federal Ministry of Industry, Trade and Investment, and the Manufacturers Association of Nigeria to explore potentials for local production of medical consumables such as face masks, gloves, sanitizers, and even equipment like ventilators. This is in view of the looming global shortages of medical supplies for response due to high demand by all countries. Clinical trials and other processes are ongoing to validate various therapeutics for COVID-19 treatment. I have been notified of gifts of medical supplies from China, courtesy of a group of Chinese companies working here in Nigeria. A special cargo aircraft shall leave Nigeria in a few days to collect the items, which include commodities, personal protective equipment, and ventilators. Of great interest is that an 18-man team of Chinese medical experts, including doctors, nurses, and public health advisors, shall come along with the flight to assist us. I must at this juncture commend our frontline health workers who are doing a great job in case identification and management. As we prepare to contain COVID-19 outbreak, we must not lose sight of other health challenges in our country. Routine healthcare service must continue in all hospitals. Only a wing of tertiary centers need to be put to use for infected patients. I also urge all states to find more beds for isolation and treatment, and this may include renting hotels. It is important that we do not drop but continue our services, including maternal and child health and immunization. I shall communicate this to the commissioners of health of the states. I shall also instruct all federal health institutions to this effect and for them to work with state officials. Those who have to deal with coronavirus patients are, as I said, to commit only a wing of their hospitals. And to this purpose, they have all been supplied with starter packs of personal protective equipment and consumables. I want to remind you all again that all these efforts will not be effective if we do not cooperate fully with the government. We recognize that the lockdown may be difficult and inconvenient, but it is necessary for the good of us all. Thank you.